talk a little bit about some of the public benefits that are available to young adults and what changes around age 18. So we've already started talking about SSI, Social Security Income, also SSDI, Social Security Disability Income. SSDI is for people who have a work history and are no longer able to work due to disability. SSI is most likely what young adults will be applying for because they don't have a work history. Okay? SSI can be very helpful because two things come with it. One is access to Medicaid. And many of us know that access to insurance can be very, very difficult, particularly comprehensive insurance to meet the needs of young adults with disabilities. So Medicaid is one of the most comprehensive benefit packages available. So either having or maintaining access to Medicaid can be very important, and that is something that comes with SSI eligibility. The other is cash support, and that cash support, there's both a federal component and a state component to it, and it is dependent on whether or not that young adult has any income. An income is allowed, and you can maintain eligibility for SSI. So it can, and what that young adult is paying for. So whether or not they're paying for rent might determine how much that cash stipend is. But that can help pay for things like tuition to go to a technical college, or to take a class online, or to explore a work opportunity, transportation, many, many things, expenses that young adults have related to their next steps can be help supported by SSI. And as we said, that application is can be turned in right around that 18th birthday. Eligibility determination can take some time. It might not if it already has been done, and benefits then become available. Next to be thinking about, we talked a little bit about Medicaid coming with SSI, but let's just talk a little bit more about Medicaid. So some kids can be enrolled in Medicaid through SSI. They might also be enrolled in Medicaid through what's called Katie Beckett. Katie Beckett is a doorway into Medicaid. And kids can stay enrolled in Katie Beckett up to their 19th birthday. So the idea is that if there's a transition in applying for SSI or other disability programs, that there's some wiggle room for that process to play out before they lose eligibility for Katie Beckett. But know that that you need to make a change starting around that time if your young adult is eligible for Medicaid through Katie Beckett. And then also if a young adult is eligible for Medicaid through Badger Care, that eligibility also only exists up to age 19. So again, a young adult who has access to Medicaid through Badger Care will lose it at age 19 unless some action is taken. There's one benefit that is no longer available to adults that is available to children, and it's called Health Check Other Services. There's a link to it in the packet. Health Check Other Services covers things like over-the-counter medications, other kind of specialized medical supplies that aren't otherwise available on the card. So, for example, if Health Check Other Services is currently paying for over-the-counter allergy meds, vitamins, other supplies, that your young adult will no longer be eligible for that after age 19. So Health Check Other Services ends at up to age 21. I said 19, that's wrong. Health Check Other Services goes up to age 21. Next, let's talk a little bit about what's called Vocational Rehabilitation Services. You might hear people refer to the acronym DVR, Division of Vocational Rehabilitation. DVR provides supports to individuals with disabilities who are eligible to help develop skills, seek out educational opportunities, find employment, and maintain employment. So it is an important resource if you're thinking about employment after school. DVR, a young adult has to apply. There's something called order of selection, so basically there's a wait list for services, and sometimes that wait list is very, very short. But those with the most significant disabilities are served first or considered a higher priority in the order of selection, and then there's different groups based on significance of disability. So that's an application that you want to be thinking about. Oftentimes schools will bring in DVR and work with DVR, so you want to ask your school about that if that conversation has not already taken place. DVR can get involved anytime, but certainly by age 18 they should be part of the IEP discussion. Also be thinking about sort of what are called generic or community-based economic supports. So what are the supports available to people living in the community related to housing and food assistance? So for example, food stamps, food share. Those are all resources that might be available to assist young adults over the age of 18 to live in the community. Also transportation. Is there a public transportation system available, and then does that transportation system also have accommodations or transportation available to people with disabilities? So for example, door-to-door service for those with disabilities who meet the criteria for access to public transportation. And then let's talk a little bit about long-term supports, what are sort of generally grouped together under the term Medicaid waivers. So for example, there may be young adults who are participating in what are called the Children's Long-Term Support Waivers. Those waivers go up to age 22, and then that young adult is no longer eligible for the children's waivers. And here there's a little caveat, it gets a little more complicated. In our state, we have a divided sort of system of supports for adults with disabilities. Some counties in our states have access to adult long-term supports and can move seamlessly from children's supports into adult supports. Others do not. So of those who are here, New Auburn, actually I'm going to do it in the reverse. The sites that do not have access to adult long-term supports without waiting are Rhinelander, Luxembourg, and Madison. So in the rest of the sites, you have an adult long-term support program called Family Care, IRIS Partnership, and there should be a discussion and a planning process so that transition can take place at age 18 or shortly thereafter. So again, kids can stay on the children's waivers in counties that do not have the adult long-term support system in place called Family Care until their 22nd birthday. In counties where there is family care, the expectation is transition will take place shortly after their 18th birthday. Okay? So again, the Aging Disability Resource Centers are a really good place to have that conversation. If you have a child enrolled in the children's waivers, then you should be talking to your county service coordinator about what happens when your child turns 18, what to expect, and what kind of planning you might want to put in place. I mentioned Family Care Partnership, PACE, IRIS, the names on your slide. These are the names for the adult long-term support programs. If you have a child who's eligible for the children's waivers or Medicaid through Katie Beckett, they are most likely going to be eligible for these adult long-term support programs. If you don't know, you should contact an Aging and Disability Resource Center and ask. The adult long-term support programs provide a lot of the support that a young adult would need to live in the community. It can include support related to having a job, to living in their own home, to connecting with other community activities and friends, to help with some specialized assistance, many, many things that young adults need to live in the community. So the long-term support programs can be very, very helpful and important. In the counties where we do not have Family Care, IRIS, PACE, and Partnership, we have what are called the legacy waivers. You might have heard KIP, Community Integration Program, COP, Community Options Program. These are adult long-term support waivers available in non-family care counties and provide very similar kinds of supports. One of the biggest differences is that in family care counties, transition should be seamless and happen without waiting. No waiting lists. In counties where there is not family care, there can be significant waiting lists for access to those long-term supports. So when kids are off the children's waivers, you may be waiting for additional supports, which is why some of these other things that we're talking about are also very, very important. If the discussion about family care and where it is and isn't is confusing, hopefully this map will help clarify those counties that are in, I think it looks either yellow or white, are counties where family care is not currently available. The rest of the counties, family care is available. Okay. The other color difference is whether what sort of variety of long-term support programs are available. So they all have family care and IRIS. Some also have something called Partnership and or PACE. Not too important at this point. The main thing to remember is there is an adult long-term support system available, and call your Aging and Disability Resource Center to begin the process and get more information about it.
Do white ones have ADP?
Again, there are a variety of resources available to you.